Have you ever thought about how cannabis could transform your daily life? Today, we are diving deep into the science and benefits of cannabis with our guest, Dr. Amanda Reiman, a trailblazer in cannabis research with over 20 years of experience. She specializes in substance abuse, treatment, drug policy, and social work, offering a unique perspective on the social and cultural impacts of cannabis. In this episode, we explore how cannabis can serve as a substitute for alcohol, medical prescriptions, and illicit drugs. Dr. Reiman also shares a practical guide for incorporating cannabis into daily routines to enhance wellness, manage stress, and provide a safe alternative to substances like alcohol, sleeping aids, and painkillers, from its therapeutical potential to its role in fostering balance and mindfulness. We aim to clear misconceptions, challenge common myths, and provide you with a science-backed insights on cannabis, its benefits, risks, and how to use it mindfully. Hi, Amanda. Welcome to my podcast. I am really excited to have you here and appreciate you are taking the time to join us today. To
It's
start,
my pleasure.
I would love to hear more about your journey. How did you first get introduced to cannabis, and what inspired you to dive deeper into the field? Was there a specific moment or experience that sparked your interest in researching it?
That's a great question. As you mentioned, I've been researching cannabis for a little over 20 years, but I've been a consumer longer than that. So I started using cannabis in my early 20s. I'm
Wow.
now 48. And when I started using cannabis, it was very much illegal. I was living
Yeah.
in Chicago. I also lived in Texas. And in order to obtain cannabis, you had to have a guy and then you had to meet him somewhere and there was a risk associated with it. And so one of the things that really drew me into the field in the beginning was the fact that cannabis was illegal and better understanding the impact of cannabis prohibition, especially on vulnerable communities. I understood about the arrest rates being higher for certain populations than other populations, and also the long-term, lifelong impacts of having a drug charge on your record. It
Mhm.
was preventing people from getting jobs, from getting housing, from voting in some cases. And so I was thinking this isn't really fair. Cannabis is a fairly harmless substance. It can actually provide a lot of therapeutic benefit. And the idea that somebody would have their life ruined and taking away their ability to be successful, to have opportunities because they were consuming cannabis just seemed like it was a social justice issue for me. So in 2002, I moved to the Bay Area, California, where they had medical cannabis. And one of the first things I noticed was that medical cannabis dispensaries were providing a lot of really good public health and social services for medical cannabis patients. And so at that moment, I decided that not only did I want to try to end prohibition on cannabis so that people weren't getting in trouble for it anymore, but that also I wanted to study what was happening because cannabis, even though it's been around for thousands of years, has been prohibited in the United States since the 1930s. And so I found myself at a time where that was being challenged, and we were starting to see states and people think that maybe it shouldn't be illegal. And I thought, well, what an amazing opportunity being a public health researcher, being somebody who has a relationship with the cannabis plant, to study this evolution of cannabis from an illegal to a regulated substance. So that's really how I got interested in it.
Wow, that's really insightful. Thank you for sharing that. On the flip side, every journey has its challenge. What would you say was the hardest or most difficult part of your path into cannabis research? Was there a particular obstacle or moment that really tested you or made you doubt your decision to pursue this field?
Many moments made me doubt my decision to pursue this field. I think the biggest challenge of being a cannabis researcher, at least 20 years ago, was that there was no funding or support for cannabis research except to study it as a harmful substance. So today, 20 years later, that's really changed. We have the National Institute of Health and other federal agencies that are giving grant money in order to study the benefits of cannabis. We see cannabis research happening at high level academic institutions, universities across the country. And so it's really come a long way. When I first started, none of that existed. So it was very hard to get any kind of funding to study the benefits of cannabis. It was very hard to get universities to support the study of cannabis. Now, I was very lucky because I was at the University of California at Berkeley, which has kind of a long tradition of being a bit more progressive. I had other friends at other universities where they were told they were not allowed to study the benefits of cannabis. So that was really, I think, the biggest hurdle as a researcher was just having the support and the funding that you need in order to conduct the research. I think another big challenge was that, at least back then, cannabis was still highly stigmatized. There were a lot of negative feelings about people that used cannabis. A lot of people who used it didn't feel comfortable talking about their cannabis use. And so, getting to research and do survey research with people who used cannabis was pretty difficult. And so I think that's also changed and the stigma has gone down and people feel more comfortable. But 20 years ago, it was hard to get somebody to talk openly and honestly about their cannabis use.
That's amazing. And it ties into my next question. Amanda, can you share with us some of the latest cannabis policies and how they are shaping the industry today? What changes have you seen recently, and what impact do you think they will have on both on the public and the research side of things?
Well, that's a great question. And we certainly have seen a lot of policy over the past 20 years. So thinking back to the first medical cannabis law in the US, which was 1996 and Prop 215 in California, up till today, where almost every state in the US has some kind of cannabis law, whether that's medical only access or adult use access. There's only a handful of states that completely prohibit cannabis now. So the policies have really changed. I think one of the big changes is removing the criminal penalties for possessing and using cannabis. So in most states before legalization, if you got caught with cannabis, even a small amount of cannabis, you could have a fine or you could go to jail in some states. And so with legalization, we've seen those policies change so that that's no longer a crime, which I think is probably the most important aspect of legalization, right? Because we don't want people to go to jail and have their lives ruined for having cannabis. I think a second big policy change is access. So as I mentioned, back in the day in the 1990s, we didn't even have cell phones, right? So we had pagers where we would get in contact with somebody who could sell us cannabis, and they would show up somewhere with a bag of cannabis, and you didn't know if that was safe. You didn't know if it was contaminated. You didn't know what it was. They basically just said, this is what I have, and this is how much it cost. And you took it because you didn't really have any choices. Now we see a system of regulated access where I can go to a store. I live in Washington State where cannabis is legal. And I can go to a store and I can buy products that are telling me how potent it is and who grew it and that it's been tested for contaminants. I can buy edibles like gummies and other products that are tested and that are standard dosing and that I know are safe. And that's a huge policy change that we didn't have back when cannabis was illegal. And then I think the third big policy change is medical use. So, cannabis is fun and it's good for relaxation and enjoying things like food and music and art, but it also has a lot of therapeutic benefits. And so the ability of people who want to use cannabis instead of opiates or instead of anti-anxiety medication or instead of sleep medication and are able to access cannabis legally and consistently really helps it be that true substitute for pharmaceutical drugs.
I think so. Thank you. Every day, life can feel overwhelming with its constant demands, and many people turn to alcohol as a way to cope with stress or relax after a long day. How can cannabis serve as a safer and more more safer alternative to managing stress?
Well, that's also a great question. And, interestingly, in states that have cannabis that is legal, like Colorado, we are starting to see cannabis sales outpace alcohol sales. We're also seeing less drinking happening among Gen Z. So the younger generation is moving away from alcohol. I think,
Mm,
for a long time, alcohol was really the only option if
mm,
you wanted to feel a little like relaxation after work, if you wanted to feel a little intoxicated. I mean, it was really what you had available to you. And so people drank it. And most people drink alcohol without any issues, right? They might have
mhm,
one too many occasionally and wake up with a headache the next day. But very few people become addicted to alcohol. But that being said, it still has a lot of risks associated with it. You can fatally overdose on alcohol if you drink too much. Drinking too much is associated with making poor decisions, with
mhm.
having poor coordination, issues with driving, issues with aggression. So there's definitely some societal harms that come from drinking alcohol. Now that cannabis is an alternative for people, right? Now that it's just as easy for a lot of folks to stop by a dispensary after work and pick up a joint as it is for them to stop by the grocery store and pick up a beer, that's really what we had to get to in order for cannabis to be a really viable substitute for alcohol. Because alcohol is so easy to obtain that it's like if on the one hand I just have to go to the grocery store, and on the other hand I have to call a guy and wait for him to call me back and meet him somewhere and take a huge risk in order to do that,
Yeah.
alcohol is going to be the one that I'm going to choose. But
Yes.
now things are different. So I can go pick up a hemp infused beverage at a store that also sells alcohol. And so I think people are now saying, these are just as easy to obtain. And with the cannabis beverage, I know that I'm not going to have a fatal overdose. I'm not going to have a hangover. It's not going to
Mm.
lead to bad decision making. And so I think that people are finally saying, those two things being just as easy to obtain, cannabis is giving me a better experience.
Thank you. Can I use cannabis to quit drinking?
Yes, you can use cannabis to quit drinking.
Okay.
It really depends a lot on what your level of alcohol use is. If you are
Mm,
somebody who is dependent on alcohol, physically dependent on alcohol, then cannabis can be used to help get through alcohol withdrawal. So when you quit using alcohol and you're physically dependent on it, you may experience nausea, tremors, a lack of appetite, mood disturbance. All of these things can be treated with cannabis. So, on the one hand, cannabis can just help people make it through that withdrawal phase. One of the things I will mention is that if you have a severe physical dependence to alcohol, you may need medical intervention also to help you get through that withdrawal phase. But cannabis can be a very effective withdrawal medication. And then, as I mentioned, it can also be what we call a psychoactive substitute, meaning that if you just want to drink less, you can use cannabis instead of alcohol. And maybe now you're having one beer instead of four beers
mm,
because you're having a beer and you're having a little bit of cannabis. Maybe if you want to stop drinking during the week, then during the week you're having cannabis. And maybe on the weekend you have a few alcoholic beverages. So I'm a big believer in harm reduction, meaning that instead of it being like an either or, like you either drink alcohol or you drink cannabis, it's like, how can we bring in these two substances and then reduce the overall harm by making choices that are as healthy as possible?
wow. There is a belief that cannabis is no more dangerous than alcohol. Based on your research and expertise, how do you think cannabis compared to alcohol in terms of risk and social implications?
Excuse me. Well,
Sorry.
as I mentioned, the fatal overdose issue is a big one.
Yeah.
So one of the big risks with alcohol is that if you drink too much of it, your brain basically stops telling your lungs
Mm,
to breathe and you will die. Right. So
that's
like
crazy.
that's a huge risk, like
Yeah.
huge risk, right? That will never happen with cannabis because
Mm,
cannabis doesn't impact the part of the brain that regulates breathing. So no matter how much cannabis you use, your brain will never tell your lungs to stop breathing. So that's why
mhm.
one has the risk of fatal overdose and one doesn't. When it comes to behavioral risk, as I mentioned, we look at things like domestic violence,
Okay.
aggression, poor decision making, more common with alcohol than with cannabis. We definitely see people have things like coordination issues or short-term memory issues when it comes to cannabis, but we don't see people making decisions that they wouldn't make when they were sober when they use cannabis. So, in terms of harms related to the public health and safety of society, cannabis is a much better choice. Now, when it comes to driving, nobody should drive while intoxicated. I want to
Mm.
make that clear. If you are an
For me,
intoxicated person, do not get behind the wheel of the car. That being said, people that use cannabis very regularly and are very used to it and have a very high tolerance show the same level of driving skills as people who are
mhm.
sober. Whereas
Yeah, I've
people
seen
who
that.
are drinking, they can go pretty quickly into somebody that's not able to properly drive. So we don't see as much concern with driving under the influence of cannabis as we do alcohol. Although, again, if you are feeling intoxicated, it doesn't matter if it's cannabis or alcohol, you should not be driving. In terms of health effects, we know that alcohol can be harmful to the liver, right? Alcohol, you're
Mhm.
drinking it, it's being processed through the liver. That is a risk. Like I said, dependence with alcohol is a higher risk than dependence on
Mhm.
cannabis. So I think when it comes to health effects, cannabis is definitely safer. However, one last thing is that cannabis smoking, even though it isn't directly linked to lung cancer, over
Mhm.
time, it still can be damaging. It can be damaging to your gums, the inside of your mouth, your voice,
Mhm.
your lungs, not in a cancer way, but like in a chronic bronchitis kind of way. So I do suggest that if you're somebody that uses cannabis regularly, try not to have smoking as your only method of ingestion. Change it
Mhm.
up, use a vaporizer, have some edibles, and just be careful about how much you're choosing to smoke.
Wow. Thank you for your advice. Opioid use, even short term, can lead to addiction as a short term pain relief leads to a potentially life threatening problems. In your opinion, can cannabis be an effective alternative to opioids for pain management?
Absolutely. So, one of the strongest cases we have for cannabis as a medicine is for pain relief.
Okay.
Now, without going too deep into the science, we all have endocannabinoid systems in our bodies, which is basically a system similar to the nervous system that regulates different body systems and sends signals throughout our bodies for things like mood, pain, sexual desire, appetite, relaxation. These are all controlled by our endocannabinoid systems. And our endocannabinoid system creates chemicals that are the same as the chemicals in the plant. So the chemicals in our bodies are endocannabinoids, the chemicals in the plant are phytocannabinoids, but they're the same thing. So what that means is that we have receptors all through our bodies that are perfectly shaped to accept endocannabinoids or phytocannabinoids, including pain receptors. So when we look at the ability of cannabis to impact pain, it's because when you introduce those phytocannabinoids into the system, they're traveling through the body and they're going to those pain receptors and they're blocking that receptor. They're basically going in and filling that little keyhole in the receptor so that the signal from the brain of pain isn't able to get through. So that's the mechanism by which cannabis can work for pain. Now, as you mentioned, there's a lot of risks with opiates. I want to start off by saying opiates
Mhm.
are not inherently evil. Opiates can actually be extremely valuable to people who have pain. So even though there's high risk, and even though people are prescribed opiates for longer than they need them, and in cases where they shouldn't be taking them, for some cases, opiates are extremely valuable. So I just don't want to
Mhm.
sound like I'm totally like dissing
No opioids.
opiates. However, we do have research that shows that if people use opiates and cannabis together, they're
Mhm.
actually able to use fewer opiates farther apart. And so you mentioned one of the big risks with opiates, there's two big risks are overdose and dependence, right? And your risk of overdose and dependence increases the more opiates you need to take and the closer together you need to take them. So if you're able to use cannabis and opiates for pain together, instead of taking 4 pills every 4 hours, you may be able to take 2 pills every 6 hours. And what that's going to do is it's going to reduce the chance of overdose. It's going to reduce the chance of dependence. And you're not going to be getting the side effects with opiates that people don't like if you're able to reduce the number of opiates you take. Now, similarly with alcohol, if you have dependence on opiates, cannabis can be a very effective withdrawal medication. So similarly to alcohol, a lot of the same symptoms of withdrawal with opiates, things like muscle spasms, trouble sleeping, trouble eating, mood disturbance, all of these things are symptoms that can be treated with cannabis. So cannabis is great as a treatment for pain. It's also great as a treatment for people who have dependence on opiates.
Amazing. Cannabis and depression. What should we know about its potential benefits and risks?
Well, anytime we talk about cannabis and mental health,
Okay.
it's complicated. It's definitely a lot more complicated than cannabis and pain, right? Because we talk about pain,
Well,
it's like, all right, my brain is sending a signal of pain. Cannabis is going to block that signal. I have no more pain. Or I have inflammation on my joints because of arthritis. I rub some cannabis topical on my joints, and that makes the inflammation go down. It's pretty cut and dry. However, cannabis and mental health have a pretty complicated relationship. And in some cases, cannabis can be a benefit to somebody who's having negative mental health symptoms, but sometimes it can make those worse. And just like every medication that's out there for mental health, you may have to try a few before you find one that works for you. So you might know someone that's used cannabis to treat depression and it worked really well for them and they were able to go and do things again and eat and sleep and the things they were having trouble with. And then you may talk to somebody else who says, cannabis actually made my depression a lot worse. And so what we always tell people is with cannabis, start low and go slow. If you are somebody that's experiencing depression and you want to see if cannabis is going to elevate your mood, start really low dose, go really slow, and take a lot of care to notice the impact that cannabis is having on your symptoms. Because what can happen is that somebody that's feeling depressed might start to use cannabis as an escape. So it's not really treating their depression. It's more like a false sense of happiness, but it's not really getting to the root of what's going on. And I'll also say there's kind of 2 types of depression out there. There's what we call circumstantial depression, and then there's clinical depression. And with circumstantial depression, it's like, oh, I lost my job and I'm sad about it, right? And I'm feeling depressed because of something that happened in my life, and I'm having trouble eating and I'm having trouble sleeping and I'm feeling sad, but it will pass. Right. It's not something that I felt before. It's something I started feeling when this thing happened. And over time, I'm going to feel better about it. So in that situation, cannabis might be helpful. It might comfort you. It might make you feel a little better while you're moving through this. There's also clinical depression, which is that your brain is actually not operating correctly and not releasing enough of the chemicals that make you feel not depressed. And in that scenario, there may be intervention required beyond cannabis to help deal with that chemical imbalance. And cannabis may actually just end up masking the symptoms, but not really getting to the root cause of that depression.
wow, that's a powerful point. What does cannabis improve or disrupt your sleep?
Again, it's going to depend. And in this time,
Depend.
it's not going to depend as much on the person as it's going to depend on the cannabis product that you are using. So cannabis has dozens of chemical compounds inside it, most of which we refer to as cannabinoids. And then in addition to cannabinoids, there are things called terpenes. Both cannabinoids and terpenes impact the effect that cannabis has on you. So if folks are out there listening and they might say, yeah, sometimes I'll smoke one type of cannabis and it just makes me want to go to sleep. And then I'll smoke another type of cannabis and it makes me want to clean the house. Like there's a reason behind that. And it has to do with the cannabinoids and the terpenes that are in the plant. So if you're looking for cannabis to help you with sleep, there's certain things to look for in your cannabis product. So when it comes to cannabinoids, you want to look for CBN.
Mhm.
CBN is a cannabinoid that helps with sleep. It's actually what THC turns into when it becomes really old. So if you've ever like been cleaning your room and have found like a really old baggie of weed and you're like, I wonder if this is still good, and you smoke it and it immediately knocks you out, that's because of a lot of the THC in that cannabis has probably become CBN at that point.
CBN.
When it comes to terpene profile, there are some terpenes that give you energy. So limonene, for example, terpinolene, these are both terpenes that are going to be uppers. So if you're trying to
Mhm.
sleep and you smoke something with limonene, you may be
Mhm.
laying there like going over every big event in your life while you're laying there trying to go to sleep. There's other terpenes like linalool and myrcene that are relaxing terpenes, and they're the ones that are going to help you feel relaxed, that are going to help you fall asleep. So if you're somebody that's like, I want to use cannabis for
Mhm.
sleep, look for something with CBN and look for something with linalool and
CBN.
myrcene. And these are going to help you fall asleep because cannabis can be very stimulating if you have the wrong kind. So it's important to know what cannabinoids and what terpenes are going to help contribute to helping you fall asleep.
Gracias. That's great. Thank you. Uh, what do you mean when you refer to cannabis as a smart drug? How can it potentially enhance mental clarity or cognitive function? Is there evidence to support its use in providing brain health or performance?
So these are kind of two separate things. So when we
Yeah.
talk about cannabis, it has been shown to be a neuroprotectant and also to help regrow brain synapse connections. And for this reason, it's very valuable for people that have experienced traumatic brain injury.
Mm.
So, folks that are athletes, for example, and have gotten hit in the head a lot
Mhm.
in the sports that they're playing, and maybe have CTE, which is a disease that happens when you have a lot of traumatic brain and head injuries. Cannabis can actually help reduce swelling in the brain. It's an anti-inflammatory that will reduce the likelihood of developing CTE for people that have had traumatic brain injuries. And because of this, retired football players and others that have been in sports where this is a huge issue have really advocated for the being able to use cannabis while they are athletes because of its effect on the neuro health of the body. It's also been looked at for Alzheimer's patients and people that have degenerative diseases of the
Mm.
brain because it does help preserve those neural pathways. So I think that there's a lot of promise in looking at cannabis, especially CBD. Remember, we talked about those
Yeah.
cannabinoids.
Mhm.
THC is probably the most well-known one because that's the one that makes you feel high. CBD doesn't
CBD.
make you feel high, but it's got a lot of really good therapeutic benefits, including anti-inflammatory effects and neuroregenerative effects. So I think when it comes to brain health, CBD is extremely promising for people that have experienced brain injury or people that have degenerative diseases that
Mm.
impact the brain. Now, when I call cannabis a smart drug, I'm
Mhm.
actually not talking about it in terms of the brain. That goes back to our endocannabinoid system. So, because we have endocannabinoid receptors in our bodies, cannabis goes into our body and it stops and it thinks about what it needs to do in our body. It goes to where it's needed instead of just blanketing everything. A lot of times when we look at them, pharmaceutical drugs, painkillers, anti-anxiety medication, it hits a lot of things in the body where it's not needed because it doesn't know how to target where it is needed. Another example of this is chemotherapy. Chemotherapy for cancer basically kills everything in your body. And the hope is that it kills all of the unhealthy cells before it kills the healthy cells. The research on cannabis and cancer shows that when cannabis is introduced to the body, it only targets the unhealthy cells and it leaves the healthy cells alone. So, kind of like a smart bomb that knows where to go and knows where its target is, cannabis acts the same way in the body.
Amazing. There is a common misconception that using cannabis can lead to addiction or encourage the use of a stronger substance. Is this true?
So the gateway theory is
Mhm.
not correct, right? This idea that using cannabis somehow causes you to want to use harder drugs is not
Mhm.
accurate. And the way we know that is that about 60% of the adult population has tried cannabis, but only about 0.6% of the adult population has tried heroin. So if cannabis caused you to want to use heavier drugs, we'd see much higher rates of heavier drug use among the adult population. Now, what I will say is that cannabis is usually used before other drugs. So even though it doesn't cause you to use a heavier substance, it usually happens before you use a heavier substance. But alcohol usually comes before cannabis, tobacco before alcohol, caffeine before tobacco, and sugar before caffeine. So there's definitely like a pathway that most people take with substance use. Cannabis is not the first drug that people use, but it usually happens before someone would use something like cocaine or even hallucinogens. So that's
Yeah.
kind of where that theory comes from, but it doesn't really have any merit. In terms of dependence and addiction, cannabis dependence doesn't really look like typical dependence on other substances. We don't see a lot of physical symptoms of cannabis dependence. That being said, cannabis can be habit forming, meaning that you can get into a pattern of consumption with cannabis and you kind of fall into that pattern, just like brushing your teeth or having your cup of coffee in the morning. And that pattern of behavior can be difficult to break, right? Just because it becomes habitual. So it's
Mhm.
important, and I like to talk about mindful consumption. It's
Okay.
important that our consumption of cannabis, that we think about it. Why am I doing this right now? Am I
Mhm.
doing it just because it's here and I just do it? Or am I trying to get something out of it? And I think that that's really important for using cannabis, for using caffeine, for eating food, like all of the things we put into our body that may be beneficial, but also if we use them to excess can bring harm. We should really be mindful about why we're consuming it so that we don't end up into a habit where we're not really getting anything out of it anymore, like enjoyment. We're just doing it because we're so used to doing it.
Oh, this is tied to my next question. Cannabis and dependency. Many people are concerned about the potential for cannabis to become another dependency. From your extensive research, do you think it offers a safer alternative to traditional substance?
I do think it's safer. So, cannabis is safer than alcohol. It's
Okay.
safer than opiates. It's safer than a lot of other substances. It is not without risk. Nothing is
Mhm.
without risk, right? So the risk may be lower, but that doesn't mean it's not there. And that's why I say that we shouldn't just use cannabis with this idea that it's a completely harmless and risk-free activity, because it's not, right? If you use the wrong type of cannabis, or if you use too much THC, or if you use in the wrong environment, you can get anxiety. You cannot feel very good.
Mhm.
There's definitely risks to using cannabis incorrectly or to excess. Now, are you going to die? No. And so that is what makes it a lot safer than something like alcohol or opiates. But people still need to understand the potential risks, and they need to use cannabis in a way that's going to minimize those risks. Like if you're going to an event where you already know you're going to be anxious, let's say it's an event with a lot of people and a lot of noise and music, and those types of events already make you anxious. Expect that if you use cannabis, it may make you more anxious, right? There
Yeah.
is such a thing as a THC overdose. You can take too much THC and not have a good time. You're not going to die from it, but you can feel pretty crappy. So those things all exist. And I think it's important that people understand the risks so that they can make the most of the benefits.
Thank you, Amanda. We get to our last question and the most important. Amanda, with all the expertise you gained through your career and everything you've been through, what would you say the meaning of life is for you?
I have always been really about um, creating new pathways. I like to look at something where there hasn't been a lot of progress, but it needs to happen. And I like to take the risk of being one of the first to move down that path. When I first started working in this, like I said, like there wasn't funding for cannabis research. It was very hard to have a serious career as a PhD and study cannabis. But that's where I like to be. I don't like to wait until someone else has clear cut the path and just say, all right, here's the path. Now you can walk down it. I like to cut the path. So for me, whether I'm doing cannabis or anything else, I've always looked for things where the path has not yet been cut. And that gives me the opportunity to be one of the first on board.
I am sure our audience will appreciate hear that. Thank you so much, Amanda. We finish.
My pleasure.
Thank you so much for tuning in this episode of The Road to Victory. I want to give a special thanks to Amanda Reiman for joining us and sharing her insights. Today, we dive into some powerful discussions about challenging cannabis research and legalization, touching on the reasons many people turn to cannabis as alternative to substances like alcohol and medical prescriptions. Amanda highlighted key points around how cannabis, particularly CBD, is showing promise in managing symptoms such as anxiety, pain, and insomnia, while carrying a lower risk of addiction and withdrawal compared to traditional treatments. As we wrap up, I want to leave you with a thought. Change often start by challenging what we think we know. The conversation around cannabis are evolving, and while there is still a stigma and legal hurdles, progress is made when we remain open-minded and educate ourselves and advocate responsibly. If you're considering cannabis for relief, seek knowledge, consult experts, and make informed decisions. Thank you so much for tuning in. If you enjoyed this episode and want to dive deeper into more thought-provoking discussions like this one, don't forget to like and subscribe to our podcast to follow us on our Facebook and Instagram, where we share our daily road to victory. And you can listen to our podcast on Spotify and watch on YouTube, where you can find all our podcast episodes. Your support means the world to us and help us bring more valuable conversations to you. Thank you for listening and see you in the next episode.